Many Republicans are slamming the spending bill for focusing more on borders like Ukraine's, other than the United States. Let's bring in Arizona Republican Congresswoman Debbie Lesko, a member of the Border Security Caucus. Congresswoman, thanks for joining us this afternoon. You know, if we went through the whole $1.7 trillion bill, we'd be here for quite some time. So let's focus on particularly the border aspects. What does this bill do for the border? What doesn't it do?
Well, it gives more funding to the border, but only for processing more illegal immigrants. It specifically says in it that it's prohibited to fund more border technology for security of the border and only for processing more illegal immigrants. So just like all of the other priorities that Democrats and President Biden have, it only incentivizes more illegal immigrants to come here. And the cartels are the ones that are making all the money off of this. They're making money off of people that are being trafficked from all over the world, and they're making money off of drugs. I mean, as was said in a previous article that you had, there was over 1 million fentanyl pills discovered in 24 hours in Nogales, Arizona, port of entry. And this happens like all the time. And that's just what's discovered. This is a national security crisis. It's a humanitarian crisis. And the Biden administration doesn't care. They want open borders. They keep prioritizing illegal immigrants over U.S. citizens.
Do you think, Congresswoman, with a Republican House upcoming in just really a week and some change now, that there's a legislative compromise available? You've got senators on the Senate side who were working on a bill, a little bit of the compromise there. Senators Sinema and Tillis are working on something that would extend Title 42. It would change asylum laws where you'd have to claim asylum at a port of entry, and then in exchange, you would get 2 million dreamers in the country, those brought here illegally as children, a path to citizenship. Is that the type of framework or something based close to it that Republicans in the House could get on board with? Or do you see us legislatively in 2 years where we are right now?
We've been trying to solve the border security crisis for many years, and it's just gotten worse, especially under the Biden administration. When I first came to Congress, there was an attempt by Republicans to help solve the problem. It combined border security along with giving legal status to DACA recipients. I was in support of that legislation. Unfortunately, not one single Democrat voted for it. And so now they come back and say, we want to give legal status or citizenship to DACA recipients, but yet they don't want to secure the border, as can be seen from this $1.7 trillion omnibus bill. They want just more money for processing illegal immigrants. They want more illegal immigrants to come into our country. For what reason, I can only guess. But that's their priority. So if we're going to do this, and Republicans tried to do it in 2018, Democrats have to support it too. I'm willing to work on it, but I don't know. That's a very difficult hill to climb.
You'd also mentioned that massive amount of fentanyl that was captured in a 24-hour period. This was 1 million fentanyl pills at Nogales at the port of entry there in the last couple of days. That was from earlier in the week. So within just a couple of days, you had 1 million fentanyl pills seized there. How much of the problem do you think is at ports of entry? DEA has been saying for years that the bulk of the drugs coming into the country through the southern border, they're hidden on tractor trailers. Has that changed now with so many more migrants coming over in between the ports of entry, or do we need to, as a country, still beef up the surveillance that we've got going on at legal ports of entry, at those legal border crossings?
I think we need to do both. We need to better secure the ports of entry. I mean, I've been down to the border numerous times, and they really do a good job of scanning all of the vehicles and the cars. Some of those fentanyl pills that they caught just the other day were on a train that goes from Mexico into Arizona. And so they do a good job, but of course we don't know what we're missing, right? So we're capturing all these millions of fentanyl pills, but we don't know what we're not missing. It's obviously very easy to bring across the border fentanyl, if you're crossing the border, and millions of people are crossing the border all of the time. And so they could very easily be carrying fentanyl on the people, on the illegal immigrants themselves. So we just don't know. I mean, this is unsustainable. In Yuma, Arizona, there are just thousands and thousands of illegal immigrants crossing the border each and every day. And the Yuma Regional Hospital now has a bill just in a month's time of $20 million just to treat illegal immigrants. And they're not getting reimbursed. They're not getting reimbursed by the federal government. They're not getting reimbursed by the state government. I mean, this is unsustainable. It's also bad for the illegal immigrants that are coming from all over the world. They're being trafficked by cartels. Women, young women, young teenage girls are being sold into sex trade. I was on the Border Security Caucus. We talked to the Inspector General, the Inspector General for DHS. And he said that we don't even know where these people are going. They're not vetting the families. This is a disaster.
Yeah. And you know, Congresswoman, you talk about border states like Arizona. New York City is now asking for even more funding to help deal with all of this. So thanks very much for joining us, Congresswoman Debbie Lesko, this afternoon. Very much appreciated.
Thank you.